Some of the conditions that people come in for, and we can go a little bit over these. People visit you for tests for various reasons. We didn't discuss obesity, being overweight. Now, you were saying that we're kind of a package that we're hard to see inside of. Sometimes I would say the bigger the package, the harder it is to see inside.
It is difficult. And really, unfortunately, all of us carry probably too much padding around our midsections, which makes it almost impossible to completely examine the internal organs. If you ask any physician today, they'll tell you that doing an abdominal examination is very difficult because of the size of most individuals.
Yes. So this is a way to see through all the exterior down to the organs.
Nothing penetrates fat as well as X-ray.
Tell you what. How does stress manifest itself? People who are stressed out sometimes come in for this test?
Well, we do see people who are concerned, and people are concerned for many, many reasons. People might have awareness of their family histories, and that's probably the biggest concern. But if you think you might be susceptible to a cancer because of someone in your family having had cancer, or because of some symptoms, mass, swelling, weight loss, cough, those are things that you should bring to your doctor's attention. And if your doctor agrees, or if you decide to do this, we certainly would like to see what benefit could be derived from the whole body CT scan.
And are you available for doctors to conference with you when people take their information back to their primary physician?
Certainly.
Excessive alcohol use, how does that show up in a scan?
Well, alcohol can affect the liver, most notably, and changes like cirrhosis can be identified on a whole body CT scan. But of course, we can see many, many other things: gallstones, hardening of the arteries, the effects of high blood pressure, such as aortic aneurysms. These are seen in people with alcohol problems.
When you have a brain scan, is this a condition through which you can see the early signs of things like Alzheimer's, or is this a different machine?
I don't want people to think that we can diagnose Alzheimer's with a brain scan, because truly it isn't something we can say today. But I think we can see the earliest changes of aging. For instance, our brains actually do shrink with age. There is hardening of the arteries that can be identified. You can see the evidence, certainly, of prior strokes if somebody thinks that they've had a stroke, or those kinds of changes. And as I said, in my case, I found I had a sinus infection. Some people find they have deviations of their nasal septum, things like that.
Things that are fixable.
Things that are fixable.
With regards to, you mentioned 50-ish is the age that before 50, it's not really recommended that you have a body scan. Do you see this at some point being one of the things on the checklist where women after 40 get their mammograms, men have their prostate examined after a certain age? Do you see this as something along the list of preventative health care?
I do, but I think we have to be very cautious because we have to integrate it into the bigger sort of picture of health maintenance. If you recall, recently there was a little controversy over the age at which mammography should be done. They were trying to push the age from 40 up to 50. And I think that part of that is because there is radiation involved. And we are very cautious about exposing people to radiation needlessly. There is a cumulative risk, in fact, a lifetime risk of increased cancers from needless exposure to radiation. So we're trying to be very careful about whom we recommend X-ray exposure to.
Now, with regards to preventative screening, say I have a history of cancer in my family, and I go in and I have a scan, and I'm looking good, I look fantastic. That doesn't necessarily say that at some point in the future I won't possibly have cancer that's hereditary in my family, but at this moment in time, I'm healthy.
True. And I would say that the benefits of a negative scan would be at least 5 years.
Okay, good stuff. Now, if people want more information, what do these tests cost? It's well worth the money, as I've said in the commercials that I do on our radio station. But what do the various tests cost?
The cost for a heart scan is $299. A body scan is $675, and the body and brain scan is $795.
And as I put it, at what cost? Peace of mind. And my other favorite saying is knowledge is power. I know there are some people who would rather not ever go for their annual exams, that would rather not know. But for me, knowing is a step towards either staying healthy or getting healthy.
Well, we'll never beat the odds of dying from cancer, and truly that's the reason for doing this, because the newly diagnosed lung cancer today has about a 15% 5-year survival. That hasn't changed probably in 30 years, and we'll never change those odds unless we find these cancers before people know they have them. Now, in addition to stopping smoking and doing other preventive health measures, we have to take charge of our health, and we have to identify those people who are destined to have lung cancer. And we think lung cancers probably begin 10 years or more before the first symptoms occur. So we have a big window, if we could only access that window, to find these individuals.
Yes, 10 years before you could already see something through a scan.
And we have found people who had early cancers, and by simply identifying those and tracking them, we can identify those individuals whose cancers are growing, and if they are, then they need a small bit of lung resected, and many times no more than that. No chemotherapy, no radiation, just a wedge resection of a piece of lung.
Fantastic. Dr. Breen, if people want more information, can you send them to a website where there's all kinds of frequently asked questions and concerns and important information?
Well, SacramentoHeart.com is our website, and the phone number for the heart scan is area code 916-830-2042.
And I think it's SacHeart.com.
SacHeart.com.
SacHeart.com. And the phone number one more time, please?
It's 830-2042.
Dr. Dennis Breen, clinical cardiologist with Sacramento Heart. Thanks for coming in. Important, potentially life-saving information. Thanks a lot.
Thank you, Kat.
Thank you. You've been listening to The Public File. Comments on today's show can be addressed to me, Kat Maudrew. Our street address is 5345 Madison Avenue, Sacramento 95841. You can fax me at 916-339-4559. And email is K for Kat, then MAUDRU at Entercom, ENTERCOM.com. And as always, thank you all so much for listening.